Our spines are amazing. They are the backbone of our bodies, quite literally. The spine is made up of 33 individual bones stacked one on top of the other. These bones are called vertebrae. They are divided into different regions: cervical, thoracic, lumbar, sacral, and coccygeal. Each region has a specific number of vertebrae and serves a unique function. The spine not only supports our body weight, but also allows us to move, bend, and twist. It's a marvel of engineering. They help us stand tall and protect our spinal cord, which is super important. The spinal cord is a long, thin, tubular structure made up of nervous tissue, and it extends from the brainstem to the lower back. It is encased in the vertebral column, which acts as a protective shield. The spinal cord is crucial because it transmits signals between the brain and the rest of the body. Without it, our brain wouldn't be able to communicate with our limbs and organs. The spinal cord is like a highway for messages between our brain and the rest of our body. These messages control everything from our movements to our sensations. For example, when you touch something hot, the nerves in your hand send a message through the spinal cord to your brain, which then tells you to pull your hand away. This process happens in a fraction of a second. It's truly fascinating how our bodies are wired. It forms when we're still growing in our mommy's tummies, from something called the neural tube. The neural tube is a structure in the developing embryo that eventually becomes the brain and spinal cord. It starts as a flat sheet of cells that rolls up into a tube. This process is called neurulation, and it usually happens within the first month of pregnancy. Proper closure of the neural tube is essential for the normal development of the brain and spinal cord. Sometimes this tube doesn't close all the way. When the neural tube fails to close completely, it can lead to neural tube defects. These defects can occur anywhere along the spine and can vary in severity. One of the most severe forms of neural tube defects is myelomeningocele. This condition occurs when the bones of the spine do not form properly, creating a gap through which the spinal cord and its protective membranes can protrude. This can cause problems, and one of these problems is called myelomeningocele. Myelomeningocele is a type of spina bifida, a condition that affects the spine and is usually apparent at birth. It can lead to a range of physical and neurological problems, including difficulty walking, bladder and bowel control issues, and learning disabilities. The severity of these problems depends on the location and size of the defect. It affects the spine and can make things difficult. Children with myelomeningocele often require surgery soon after birth to close the opening in the spine and prevent further damage. They may also need ongoing medical care, including physical therapy, occupational therapy, and other supportive services to help them manage their condition and improve their quality of life. But with the right help, people with myelomeningocele can live happy and full lives. Advances in medical care and supportive therapies have greatly improved the outlook for individuals with this condition. Many people with myelomeningocele lead active, fulfilling lives, pursuing their interests and achieving their goals. With the right support, they can overcome challenges and thrive. Myelomeningocele is a serious condition that affects the neural tube, which is the part of a developing baby that eventually becomes the brain and spinal cord. This condition is a type of spina bifida, which is a birth defect where the spine and spinal cord don't form properly. It occurs when the spinal cord doesn't close up completely while a baby is growing in the womb. Normally, the neural tube forms early in pregnancy and closes by the 28th day after conception. However, in babies with myelomeningocele, this process is disrupted. This disruption leaves a small opening in the spine. The severity of this opening can vary, but it always results in a gap where the spinal cord and its protective coverings are exposed. Through this opening, a sac can push out from the back. This sac is filled with fluid and can contain parts of the spinal cord and nerves, which are crucial for sending messages between the brain and the rest of the body. The contents of this sac can include parts of the spinal cord and nerves, which are essential for movement and sensation. The presence of these vital structures in the sac can lead to various complications. Babies born with myelomeningocele often face challenges with how their bodies function. These challenges can range from mild to severe, depending on the extent of the defect and the specific nerves involved. The problems associated with myelomeningocele can be significant or minor, largely depending on the size and location of the opening in the spine. The higher up the spine the defect occurs, the more severe the symptoms can be. Some babies might experience only a little weakness in their legs, which can often be managed with physical therapy and supportive devices like leg braces. On the other hand, some babies might have more severe impairments, such as an inability to move their legs at all. These cases require more intensive medical and therapeutic interventions to help the child achieve the best possible quality of life. We don't know exactly what causes myelomeningocele, but doctors think it's a mix of things in our bodies and things around us. One big thing is not having enough folic acid during pregnancy. Folic acid is a vitamin that helps babies grow healthy spines. Doctors tell moms to take folic acid so their babies' spines develop well. Another thing is family history. If someone in the family has had this problem, there's a higher chance a baby might have it too. Section 4. Spotting the signs. Recognizing the symptoms of myelomeningocele early on is crucial for effective treatment and management. This condition, a type of spina bifida, presents with several noticeable signs that parents and healthcare providers should be aware of. The easiest sign to see is a little sac on the baby's back. This sac, which is a protrusion of the spinal cord and its surrounding membranes, can vary in size. It may be small or large, and sometimes it's covered by a thin layer of skin, making it less obvious at first glance. The size and appearance of the sac can differ from one baby to another. In some cases, the sac is clearly visible and protrudes significantly, while in others, it might be more subtle and covered by skin. Regardless of its size, this sac is a key indicator of myelomeningocele. Babies with myelomeningocele often have weak or paralyzed legs and feet. This weakness or paralysis is due to the damage to the spinal cord and nerves that occurs with this condition. As a result, these babies may struggle with movement and coordination in their lower limbs. They might have accidents because they can't control their pee and poop. This lack of control is due to nerve damage that affects the bladder and bowel functions. Parents may notice frequent accidents or difficulty in toilet training as a result. Sometimes, fluid builds up in their heads. This is called hydrocephalus. Hydrocephalus is a condition where excess cerebrospinal fluid accumulates in the brain, leading to an enlarged head and increased pressure on the brain. This can cause further complications if not treated promptly. They also might not be able to feel their legs and feet, and their spine, legs, or feet might look different. Sensory loss in the lower limbs is another common symptom, and physical differences in the spine, legs, or feet can be apparent. These differences can include abnormal curvature of the spine, clubfoot, or other deformities. It's important to find and treat this early so the baby can have a better life. Early diagnosis and intervention can significantly improve the quality of life for babies with myelomeningocele. With proper medical care, physical therapy, and support, these children can lead healthier and more fulfilling lives. Section 5. Diagnosis. Figuring it out. Doctors can often see myelomeningocele before the baby is born using special tests. One test checks the mom's blood for something called AFP. If there's a lot of AFP, it could mean a problem with the baby's spine. Another test is an ultrasound. It uses sound waves to make pictures of the baby, so doctors can see the spine. After the baby is born, doctors can check their back to be sure. Section 6. Physiotherapy assessment. Making a plan. Physiotherapists are like coaches for your body. They help people with myelomeningocele get stronger. First, they ask lots of questions about the patient's health. Then, they check how the person stands and sits. They look at how much the person can move their body and how strong their muscles are. They also see how well the person can walk, sit, and stand. Sometimes they suggest tools to help with movement. Lastly, they check the skin for sores. Section 7. Physiotherapy management, getting stronger, living better. Physiotherapy helps people with myelomeningocele live their best lives. The goal is to stop problems before they happen, help people move better, make muscles stronger, and teach people how to do things on their own. Physiotherapists work with other doctors like bone doctors and brain doctors to help the person in every way. They help people with myelomeningocele get involved in getting better and reach their full potential.